Call the Health, Human and Social Services meeting to order, and the first thing on the agenda is the approval of last month's meeting. Someone like to make that motion? Supervisor McDevitt, seconded by Supervisor McGowan. All those in favor? Oh, wait a minute, any corrections or additions? I'm sorry. If there are none, then all those in favor? Aye. Opposed? Carried. Thank you. With that, we'll turn it over to you, Rob.
Okay, good morning. Thank you.
Good morning.
First item on the agenda for my portion is a 2019 Warren County budget amendment. I have a resolution request to amend the 2019 Warren County budget in the amount of $60,000.
All right, Mr. Leggett made the motion. Would someone like to second that? Mr. McDevitt. Any questions? All right, all those in favor?
Aye.
Wait, question, Mr. Leggett. I'm sorry.
This is continuing. You've been doing these substance abuse programs.
No, this is actually new funding that we were able to identify with the New York State Office of Alcoholism and Substance Abuse Services. At this point, it may not even be continuing funding. We don't know. We're advocating for that. But this is, if you recall, I had brought to committee at one point my statewide association, the Conference of Local Mental Hygiene Directors, was working with the statewide Sheriff's Association, advocating for $12.8 million for substance abuse services in the jails. In the budget, they only got like 3.75 or something like that, and they were going to not give it to all counties. They were just going to give it to certain counties and do pilot programs. But obviously some of the counties weren't happy with that. They wanted a piece of the pie, basically. So what they did is they went back and they redistributed the allocation so that now our county is scheduled to get $60,000. So we would like to work with Baywood and develop some treatment services in the jail. Baywood is already doing some transition coordination, like pre-release coordination work with a district grant, and so this would be a nice complement to that, and this would help to build off of that, and I think it would keep it well coordinated if it were the same agency doing the service.
And this is, the goal is to help avoid recidivism. Do I say that right? You know, taking care of folks when they're in there and helping them with their problem.
Yeah.
All right, any other questions?
Yeah, just a quick one. Does AA come into the jail periodically to...
I don't believe in Warren County Jail. Sean Lamery is here, and he could speak to that probably. No, they do not.
Is there any reason why they do not?
I don't know why they don't come to jail.
Okay, thank you.
Any other questions? Claudia?
Is this money going to help with that transition period? I know that the undersheriff was looking at a more seamless process for release and then into a treatment, an outpatient kind of treatment program.
This should definitely help with that. I mean, if they could engage with Baywood while they're still in the jail, then upon release, just continue with Baywood. They're already connected to service. And then the transition coordinator could also be helping them with other significant things like where you're going to live and connecting to benefits and things like that.
Mr. Leggett, does this pertain to this resolution? Because the second resolution pertains to, I believe, how we want to use the $60,000. So I guess what I'd like to do, if there are, do we have any more questions on this particular one, just amending the budget for the $60,000?
Let's do it.
Can we do? All right. All those in favor?
Aye.
Opposed? Carried. Thank you. Now, Rob, the second one, I think we kind of got ahead of ourselves here a little bit.
Yep, so the second one then, if we accept the $60,000, is to develop a contract with the Baywood Center to provide the service. And as I mentioned, they're already working in the jail doing a program that's called the ABLE, which is the Access to Better Living Experiences, I think is the acronym for it. It's the transition coordination, and we thought having the same agency doing the treatment and pre-release coordination would be, keep it well coordinated.
All right, someone like to bring that to the floor first? Supervisor Leggett, seconded by Supervisor Driscoll. Any discussion? Supervisor Leggett.
Thank you. With Undersheriff here, the percentage of the jail population that has substance abuse problems,
Well, I think percentage of the inmates who suffer from mental illness, and usually there's a co-occurring substance addiction, addiction I should say, it's over 50% of the population. We have the ability to bring services such as this into the facility. This is a big deal.
Mr. Driscoll, did you have a question?
Yeah, just a question. It's my understanding that this Wednesday, I believe, there's an Adirondack Chamber sponsored event that the three sheriff's departments, district attorneys are going to be participating in regarding substance abuse in the region. Will you be attending that also, Rob, or are you aware? Okay, you will be.
Not as a presenter, but...
No, as a, yeah.
All right, Sean, did you?
I will be. I'm one of the panelists.
Right.
No problem there.
Yeah.
Good. All right, any other questions? All right, we'll take a vote then. All those in favor?
Aye.
Opposed? Carried. Thank you.
Okay, the last thing on my agenda is an informational item. I've included in the packet a 2018 psychiatric criminal expense report. Last year was a very difficult year for us. We had to amend the budget several times to add funding for this line. Again, it's a pretty unpredictable line, but I thought I would put together some of the information so you have it in front of you. We had 21 orders for the 730 examinations. These are the competency to stand trial, and that total cost just to pay for the examinations was $72.43. Of those folks, we then had actually 4 of these folks of the 5 were deemed to be incompetent and were sent to a state hospital for restoration process. And you can see the costs associated there with those hospitalizations and how quickly that adds up. The 5th defendant that's listed there was actually somebody who was hospitalized out of the jail. So sometimes somebody might psychiatrically decompensate while they're in jail and have to be hospitalized. And when that happens, then we get a chargeback similar to the ones that go for restoration. So they're actually hospitalized for their psychiatric condition, but we have the same chargeback to the county. So those totaled, for those 5 individuals, totaled $94,842. And then at the bottom I listed where we had started the year with the budget of $25,000, and then we added in October and then December. December was an estimate, and obviously we underestimated, so we ended up $14,000 over budget. Talked to Rob Lynch, and the other problem is we don't find out we don't even get those bills until February. So at the beginning of February we got the December bill and realized where we were. So Rob Lynch said, you just have to pay it, and they have to do some sort of override. So I don't think I need any, budget amendment or permission at this point, but I just wanted to keep the committee informed as to how the year played out.
No, we appreciate that.
Just
Supervisor McDevitt.
a question, Rob. The difficulty of budgeting for this has got to be hard, okay? Because it's you really have no control over it. And number 2, is it my understanding that this is ordered by a judge?
Yeah.
So again, you have no control over that.
Right. I mean, the 5th defendant, obviously that's not a court order. That person just becomes so ill that they need to be hospitalized. So that's not a court order, but again, it's not really anything we can control for.
Any other questions? Supervisor Driscoll?
I agree with Supervisor McDevitt, although if you if you're able to take a look at past years, October, November, December, going back 2 or 3, 4 years, you might be able to come up with an average. But again, you're not going to know what 2019 is going to bring until March or February, March of 2020, unfortunately.
All right, thank you. Any other questions? Rob, you have anything else for us?
Don't have anything else. That's it.
Okay, thank you very much.
Thanks, Rob.
Thank
Enjoy
you.
the rest of your day.
Thank you.
As opposed to being dishonest.
Don't poke the bear today.
It's Monday morning, come on.
Snowing.
We like Courtney, to be honest. You know, it's good. Give me one.
We're all set? Okay, thank you.
I believe the only thing on the agenda today, I don't know if everybody got the updated version, but we took Resolution 12 off the list on the agenda that might have been sent out to you previously because I wasn't ready. So we're just going to deal with Resolution number 11.
Okay.
Requesting to create a new position. A program coordinator, peer-to-peer support services. We were awarded the Joseph P. Dwyer grant last year, and we're looking to create a position, part-time position, to fill that, which would be shared amongst Warren and Washington County. And the coordinator would be there to help support veterans within the communities of both counties, and so that they can receive services, either it be mentoring services for PTSD or referring them to local services for housing, health care.
All right, let's bring a motion to the floor, and then we can ask any questions. Supervisor Driscoll makes a motion, is second by Supervisor McDevitt. Okay, now we'll have any questions.
Yeah, just,
Mr. McDevitt?
yes, would you have kind of a guess as to what the annual base salary would be in the grade?
I do have a guess to that. 1 second. I just had a discussion with Jackie and HR, and we have finalized the job description, which I will bring back to you next month. And the guess to the annual salary would be $21,684. Now, this will all be paid for by a grant on a part-time basis.
Thank you.
Another question, Supervisor Leggett.
Yeah, so is this a bit of a professional title? You know, the program coordinator, the services they're providing, it sounds like you're working directly with veterans, or you're helping to coordinate veteran to veteran?
No, this person would be working directly with the veterans. They would be more of a boots on the ground out in the community, making that direct connection, possibly organizing events where it builds, team building to bring, we're trying to build them back up. So if veterans coming from service and, things are just not quite right, they're having a hard time finding a job or housing, maybe there's some mental health issues, underlying mental health issues, this person would help to build that person back up so they can be successful within our society.
Supervisor Driscoll.
Thank you, Mr. Chairman. You'll be working cooperatively with the VA Josh Fisher and those folks, or how will that, will be a
Well, we do now.
partnership? Yeah, you do now.
This person will just have that more direct connect with Josh,
Okay,
because obviously I can't be out of the office
Right.
as much as this person will be that person being out there. Along with the VA hospital,
Yep.
our local services,
Yep.
mental health with Rob York and his department. It'll definitely be, and it's a collaboration. So unfortunately, Ken Winchell, the director for Washington County Veteran Services, he was going to be here today and couldn't make it, but he's very supportive of this grant and can't wait for it to be up and running.
Supervisor Bramer.
I'm really encouraged to see that we're going to be doing this through a shared collaboration with Washington County. That's something that I think we could look to do more, not just in this department, but others. And I wanted to say at NISAC in January that we attended that session, you were there too,
Mm-hmm.
where the veterans offices through the county were explaining how difficult it is, or can be, to reach the veterans out in our community, and how important it is to try to help them understand that they have their VA benefits, but they also have a way to come to the county and receive additional benefits through our office. And I understand that you're doing a great job with that, so I thank you. And this will be even more helpful.
Yeah, I mean, when you think of a veteran when they discharge from service, everybody thinks VA. And that's absolutely wonderful, because the VA benefits, that's, just for veterans. But there are so many underlying local services and state services, or benefits, I should say, that a veteran would be entitled to that they have no idea that they're aware of.
Right, and this will really help with that, getting the word out, like you said.
Yep, and like I said, I mean, this person might not, so this person would be in, really the person who someone, let's say, an elderly veteran would go to for assistance with a medical reimbursement program. But we have one on a VA level, it's a federal level, but that person now would refer them to our office. So it's really a win-win. I mean, having somebody out making that face-to-face contact with these veterans, or surviving spouses even, throughout the county. Yep.
Any other questions? Question, Denise, do you want to just create this position, or did we want to do an intent to fill along with it?
Well, the intent to fill is the resolution request number 12, right? Is that correct?
I'm not, is that what it?
I wasn't prepared, per se. I do have job descriptions here with me today, but I wasn't prepared with that form. I do believe a budget layout would need to be presented with that, and currently we're waiting on an intermunicipal agreement from Washington County in order to lay that out.
All right, so you'd rather, that's fine, then
Okay.
we'll just plan on doing the creative.
I would love to do it all today. I just don't believe that I'm currently ready.
Okay, not a problem. All right, any other questions? All right, then let's vote on it. All those in favor?
Aye.
Opposed? Carried. Thank you.
Thank you.
I think this will be wonderful.
Thank you.
Thank you too, Rob. Hold on. We're all set.
Morning.
Good morning.
Item number 1 is permission to pay invoices from Adirondack Technical Services in the amount of $1,567.37. We had requested them to come in and do some services the end of December, but unfortunately they didn't complete them until January, and the contract ran out on December 31st, 2018.
All right, someone like to make that motion? Supervisor McGowan, seconded by Supervisor Driscoll. Any discussion? Ms. Bramer.
Is this coming out of your 2019 budget then?
Yes, because that's when
You
the
have the
services
money
were
to do that
provided.
and this next thing?
Yes, we have money in the budget.
All right, any other questions? Supervisor McGowan?
Was this cooler for up north?
This was the cooler at Cedars, one of them.
Cooler at Cedars.
All right, any other discussion? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
The next item is permission to enter into a contract with BPI Mechanical at a rate of $89.66 an hour from the hours of Monday through Friday, 8 to 4 p.m., and then an overtime rate of $134.49 an hour with a 30% markup for materials. And this is for repairs to refrigeration, freezer units, and ice machines at the Warren County meal sites, the Warren County Jail, Countryside Adult Home, and Department of Public Works, with the option to renew one-year renewals for 2 years.
Someone like to bring that to the floor? Supervisor Driscoll, second by Supervisor McGowan. Questions? Supervisor Leggett?
Do we have to do prevailing wage on these contracts? How does that work?
Yes, this went through the purchasing department, so I believe we are all set with that. They did review the quotes that we received. We only received one, but they reviewed it and said that it was okay.
All right, any other discussion? Supervisor Driscoll?
Thank you. Little minor issues that an existing staff person from the meal site, can they go ahead and try to make that repair and maybe jeopardize an agreement, for the equipment, or how does that work? I mean, you have to call in basically the pros, or are you jeopardizing the warranty, I guess, on the equipment if you to try to tinker with it yourself?
Typically, the warranties for any of the refrigeration units or freezer units is only for 1 year, and it's a limited warranty. So the staff wouldn't jeopardize that, but at the meal sites, we don't have staff that would be able to make any repairs like this.
Okay.
At Countryside, it might be a little bit different, but we generally just call in the pros for it.
Okay.
All right, any other questions? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
And just so you're aware of this, we did have an issue with the cooler refrigeration unit at Bolton on Friday, so we did have to call somebody in, and we called in BPI, just so that you know.
Okay, thank you.
And the last item I have is after the last committee meeting, Port Hudson Health System, who's going to be providing ISIP services for us, the expanded in-home services for the elderly program, they decided that they did not want to provide the case management piece. And unfortunately, we don't have the staffing in the office to provide that. So we would like to reduce the Fort Hudson contract to $40,000 and remove the Personal Care 1, Personal Care 2, and case management services. We would keep the social adult daycare, and then we would move those monies to the Greater Adirondack Home Aides, who said that they did have the staff to provide them.
Okay, someone like to bring that to the floor? Supervisor Driscoll, seconded by Supervisor McGowan. Questions? Supervisor McDevitt?
Yeah, what is PC1 and PC2? How is that defined?
Personal care level 1 is more of like housekeeping, preparing meals, shopping, things like that. Personal care level 2 is more hands-on, so perhaps getting them dressed, doing more entailed housekeeping, like if you had a hoarder situation, they could go in and do a massive clean, that kind of thing. So the PC2 is just a little bit more involved.
I see. So Fort Hudson is just maybe a personnel issue, a labor issue with them in terms of their lack of interest in continuing with the service?
They were okay doing the PC level 1 and PC level 2, but they did not want to do the case management piece. And we don't have the staff in the office to do that because it's visits every 6 months, it's phone calls every 2 months, it's regular follow-up, and we just didn't have the ability to do that. But Greater Adirondack Home Aides was able to do it, so we decided we would move the monies to them and let them do it.
Okay, thank you.
My question, Ms. Bramer?
Why aren't we just moving the case management then? Why are we moving all of those things if Fort Hudson was willing to do PC1 and PC2?
Because typically, there is no case management provider alone that I'm aware of in this area, and typically one agency is not going to do the case management for another agency.
So it's case management on the PC1s and 2s?
Yes.
Any other questions? All right, all those in favor?
Aye.
Opposed? Carried. Thank you. That's it? Okay, thank you very much.
Thank you. Communication management, they did indicate that they did not at this time. So we could potentially reevaluate it next year to see if they would be interested, but
Yeah.
for this year, they weren't able to do it.
We all set?
Thank you.
Okay, thank you. Unless someone had another question, are we good?
Peter, a lot of these places.
All right,
they
on
also
to
lack
social
the staff.
services.
So they've got to cut back on things that they were doing.
Basically, what you heard, I'm in
last year
between
because
them.
They don't have the people to fulfill their.
You're between what?
Oh, next
Talkers?
committee, all right, next sorry.
Why don't we contract with our, like, own public health department to provide that stuff?
I could love it.
Julie, how are you?
Thank you.
Love the tabs.
I think I have everything there, but I better take this to the safe side. I ran everything off.
Cost effective to salvage requirement, retirements and all that type of stuff. That's not going to qualify.
All right, we're all set, Chris.
Morning, everyone.
Good morning.
Before I get started, I'd like to introduce you to our new Deputy Commissioner, Christina Mastriani.
Welcome.
We're welcome.
Doing a
Nice to meet you.
fantastic job so far.
Oh, good.
Really got to work in a hurry and accomplished a lot already. A couple of big projects out of the way, and really been instrumental in working with the eligibility side of things and with Countryside. So we're very pleased at her. She's doing great.
Very nice. Great.
All right, I think the first thing that we have is a request resolution to fill the position of Social Services Investigator 2 due to a resignation. This is in the fraud unit. It's a grade 11 position.
Would someone like to make the motion? Supervisor Sokol, seconded by Supervisor McGowan. Any questions? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
The second request resolution is to create the position of temporary account clerk and fill that position. It's a grade 4, and this is for the accounting unit. It's for a period of up to 6 months. We have a person who is a long-term employee who's out for medical reasons, so we really need to fill that void.
All right, someone like to bring that motion to the floor? Supervisor McDevitt, seconded by Supervisor Driscoll. Any discussion? All those in favor?
Aye.
Opposed? Carried. Thank you.
Thank you. The next resolution is to request to create a position and fill this position for case manager grade 14. The annual base salary would be $40,954. It's a position that would split responsibilities between Countryside Adult Home and the Social Services Temporary Assistant Unit. It would be a case manager at Countryside, which is a position that we actually had in our budget and our employee grid, but we haven't ever filled it. We also have found that we have a need for a temporary assistance worker who would work in the areas of homelessness and homelessness housing. We'd like to improve our performance in that area in regards to getting people in the community who are homeless more permanency instead of just housing them temporarily. So we want to work towards improving that aspect of the work that we do at DSS. The position is reimbursed. It would be 50% from social services, 50% through Countryside Adult Home. as far as the split for the salary.
All right, would someone like to make that motion? Supervisor Driscoll, second. Supervisor McGowan, excuse me just a minute, is this the one Mr. Loeb had a question about? All right. Okay, we had a question from Mr. Loeb, who could not be here. Let me repeat that.
Yeah. He asked, how are these services currently being performed that you will require another full-time equivalent?
We have actually people who are working sometimes out of their title doing some of this work, and that's one of the reasons why we really need to get the position, especially at the countryside. We also have new regulations within DSS in regards to homelessness and creating a new homelessness plan. So we really have a need based on the fact that there's new work that we need to do that we've kind of been supposed to doing over time, and we've been piecemeal putting it together and trying to get it done. But I think it really has come to the point where we need a person to do this permanently and year-round
All
at
right.
both facilities.
All right, Supervisor Driscoll.
Thank you, Mr. Chairman. I would say that this is going to be an initiative that saves the county money. My experience is that to place homeless individuals in motels during the course of the year and other types of placements cost an awful lot of money. If you have a person providing essentially prevention services and case management services, you're nipping a big problem before it becomes a larger problem. So I would congratulate you on developing this initiative, and I would support that.
Good, thank you for those remarks.
Yeah.
All right, Ms. Bramer.
Is that what this person is going to be doing with respect to the homelessness, plan? Are they going to be helping people find permanent housing, or is there some other
Yes.
need that they will be?
I can also have our Deputy Commissioner answer that in a little bit more detail. She's been working on this quite a bit. In fact, it's one of the things that she brought to my attention that was really a void that needed to be filled. So been instrumental in working with Trish Nenninger and with Jackie in regards to the position and creating the position, the pay grade, and the duties of that person as well. So I'll let her speak to that.
So it would be working with, collaborating with outside agencies, but also providing direct services to the homeless population. So we'll be getting them on waiting lists for housing, improving our data, recording, and also taking them to look at apartments and providing more of a long-term solution than having them continue in hotels and motels and not really get any support with case management and, kind of finding things on their own. So
That's not happening right now, where we're not taking them to find places or putting them on waiting lists or working with
So we do.
other agencies.
We do, but minimally. So this is more of like a warm handoff of making sure that we're utilizing the community resources that we have. And right now, it's the work is being done, but it's not being done as efficiently as it could be done. And hopefully we'll see improvement with, instead of having people who are continuously homeless because they can't afford the places that they're staying in, you have a case manager sitting down and budgeting and working all of that out with them. So long term, hopefully there'll be more.
Who are the outside agencies that we're working with?
We're part of the continuum of care, and we're also now going to be a coordinated entry through the Saratoga North Entry continuum of care. So it's multiple agencies within our county, Washington County, and Essex
That's a good plan.
touch base with you offline, because I don't understand all of that.
Pardon me?
John Farrell is the local guy who coordinates that. And it's a group of probably a dozen different organizations from Warren, Washington counties that belong to that.
Okay.
All right, any other questions? Supervisor McDevitt?
Yeah, it seems like a really difficult issue, hard to solve, and, thank you for getting involved in that. But going forward, if you can communicate with us in terms of the actual success stories where you actually take a human being that's homeless and they actually end up in a house as opposed to in a motel in South Glens Falls.
Yeah, absolutely.
Thank you.
All right, thank you.
Just one more thing, on the reimbursement, it says 50% and then 50% is coming out of countryside budget, basically.
All the money actually goes through DSS, but the position will be split 50% at Countryside and 50% at DSS. And I think Julie can specifically answer in regards to the funding streams and the
Yes.
percentages.
For the Countryside, all expenses are reimbursed at 50%. So of the Countryside half that they're responsible for, we would get reimbursed 50%.
From who?
From DOH.
Okay.
Okay, and then of the 50% for Countryside, year one, we have a grant
Okay.
that would pay for it, and we're hoping the grant will continue if it's successful. I mean, we're certainly not guaranteed, but normally, through past practice, a grant like this, they do extend for several years, and we're hoping for that moving forward. And if we don't, we're hoping it's successful enough that it will pay for itself. Normally, our homelessness is paid out of the safety net, which is only 29% reimbursement. So even if we don't have the grant, but it's very successful, we're going to get a lot more reimbursement than if they were on a safety net program. So we should, our safety net costs should show how successful this program is.
All right, Mr. Moore?
Just a question on the case mix for homelessness. How much is TANF, how much is safety net?
Without running a report, most of it falls under safety net, but I don't have the exact.
But it's possible if we did lose the grant that it could end up being a little more than 29% because some of those cases will be TANF?
Correct.
Okay.
All right, let's move on then and vote on this particular resolution. All those in favor?
Aye.
Opposed? Thank you. Carried. Number 4.
Thank you.
Move it.
The next resolution that we are requesting is to renew the contract with Orkin Pest Control. This is for pest control services at Countryside Adult Home. This new contract would include rodent control services in additional to pest control such as insects and other vermin. The term would commence on April 1st, 2019 and go through March 31st, 2022 for a total amount not to exceed $110 per month plus an additional amount up to $500 per year for rodent control.
All right, someone like to bring that motion to the floor? Supervisor. All right, Driscoll, seconded by Supervisor McGowan. Any discussion? Yes. Mr. McGowan, is your hand up? Yes?
Yeah, because you said 31st, but in the resolution it says 30th. That gives us 31 days in March. That gives us a one-day lap. Is that true?
I would have to check the date on that.
Well, you said April 1st to March 31st.
So, okay.
And the resolution says 30th. And I can just see a big rat coming on the 31st.
I know. We can amend that, of course. Thank you.
All those in favor?
No, that's the way it would work.
Yes. Oh, there was a question? Oh, I'm sorry, Mr. Garrity.
Pay this monthly, or get an extra.
Yeah, 31st.
Get an extra month's service a year.
We've always, typically in the past, have paid it monthly. Yeah, that could be a tough thing.
All right, any other discussion? All right, all those in favor?
Aye.
Opposed? Carried. Thank you. Number 5.
Thank you. The last resolution that I have is to request to renew a contract with Hudson Headwaters Health Network for clinician services. This would be, there's 2 of them actually here for the terms commencing January 1st, 2019 through the end of this year, and then starting again in 2020 for the entire year of 2020 for amounts not to exceed $15,000 in 2019 and $15,500 in 2020.
Would someone like to bring that motion to the floor? Supervisor Driscoll, seconded by Supervisor Sokol. Discussion. Supervisor Driscoll.
Thank you, Madam Chairman. I've had conversations with Supervisor Hogan, and I've read this, and it talks about clinician, and I think on Schedule A, it defines the duties and responsibilities of a clinician, but I just wanted to, and we've discussed this before the meeting, I just want to be certain that we're reimbursing for licensed position as opposed to possibly a PA or a nurse practitioner or someone other than a doctor.
It's a licensed physician through Hudson Headwaters. I believe Dr. Smead is the doctor who handles these at Countryside, so the answer to that would be yes.
Thanks.
All right, any other questions? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
I did not run a 2018 expenditure and revenue report because with having a person out, and I've had another one with some health issues, we're a little behind on recording our revenue.
Okay.
So I could not have given you an accurate picture of our expenses and revenue for 2018, so I will plan on that for next month.
Okay.
For 2019, we start out very slow generally at the beginning of the year, as you can see, especially with revenue this year. I don't have any concerns at this time regarding either our revenue or expenditures. And for our overtime, it's continuing. We're just now filling a lot of positions. We've had a lot of overtime due to open positions, so hopefully that will help lower it, although our phone calls, our CPS calls are still real high. Our training for new caseworkers is going to be a lot higher. I think we've got, 3 going through core?
3 or 4. We also have several senior caseworkers who are going to training now for supervision training. So we've got a lot of people in training right now over at DSS.
Okay.
That involves, of course, travel to Albany. It adds a little bit to the cost.
All right, any questions from the committee regarding this report? Supervisor Levy?
Thank you. Just significant difference between 2019 and 2018 on revenue.
Well, again, a lot of that is we are behind on posting. So it's just really hard. You know, we're an office of 5 people, and I've really been down 2 out of the 5, and just trying to prioritize, and sometimes posting isn't one of them.
But you'll have a report for us next month.
I will.
So you'll see where everything stands, okay? All right, any other questions? Chris, you have anything else?
I just have a little update on some things that have been going on over there.
Good.
On the 31st of January, we met with St. Anne's Institute to discuss programs, plans, and strategies to improve some services for youth. On the 1st of February, Tammy Green and I met with Buildings and Grounds and IT to plan for some new work areas for CPS and plan some upcoming physical changes to the work areas. We had some workers spread out in other areas of the floor that they were sitting with other groups of people and stuff, so we want to kind of tidy that up a little bit. So this will be an ongoing project through the rest of the year, getting all this organized and straightened out. On the 7th of February, I met again with Pat Tadich from Planning to discuss the Countryside project and get updates on the building assessment and pending grant applications. Currently, she's working with a company, I think, out of Rochester or Syracuse that apparently is going to be coming at some point to do a full building assessment. We haven't got that finalized yet. I also filed a grant to Senator Betty Little's office in regards to getting some improvements to the building up there. The update on that is that with the change of things in Albany at the beginning of the new year, that this is going to probably take a little bit longer, and there is a possibility we might not be able to get all the funds, but we're hoping that we'll get at least some of them. I had planned in any event for these improvements to take place later in the year, so it's not really going to upset too much as far as that goes. We're just hoping that we can get most of that funding for those improvements. We've been interviewing for a DSS attorney position. We've interviewed some very good candidates. Expect to fill the position in March. We are really looking forward to getting that unit tidied up as well, because we've had a lot of turnover with attorneys over the last few years, and it's really something that we need to firm up, because there's areas that could definitely use some attention from some professionals. We started our annual federal tax information confidentiality training. Almost every staff member has to take that training. It's a requirement, and that's going pretty well. On the 20th of February, I attended a Community First Care Option Seminar. It's a new program under Medicaid that will primarily affect our Community Alternative Systems Agency clients, CASA. It's a new option that will give services that were previously not granted to people unless they had a Medicaid waiver. So APS Supervisor Julie Pearl, who also supervises the CASA unit, has been working on trying to put all these things together. We've had a couple of seminars and webinars in regards to staying on top of the recent changes and developments. It's scheduled to start up July 1st, so we're hoping everything will be in place. On the 22nd, we received notice from OCFS that New York State had officially passed the 2018 foster care eligibility review. This is an audit of entire case files that are selected from various counties. I think I had mentioned last year that one of our workers was actually selected to be a person to help perform the audit. I'm pleased to announce that the state did pass the audit, which is great. It's very difficult because they're only allowed up to 5 cases out of all the cases picked to have any deficiencies in them. So that was great news to hear, because that can affect funding if there's substantial non-compliance. So it's another audit that went well. Up at Countryside, we've started interviewing for the director position. Expect to fill the position in March as well. Since November, acting director Amy McBurn has admitted 6 new residents, and the current census is 35. And that's all I have.
Chris, we appreciate you giving us this update. It gives us a better idea of what you've been up to and what's happening in the department, so thank you for doing that.
Thank
Claudia,
you.
you have a comment?
Just quick, on behalf of the chairman, I would say make sure you touch base about the capital improvements, so we can put that on we're trying to develop a county-wide capital improvement plan.
Yeah, that's interesting that you bring that up because I've been getting quite an education from Pat Tadich in regards to these things. She's very knowledgeable and very enthusiastic. She's really into this, so we'll make sure that we keep abreast of those developments and
Planning process.
compliance with any sort of things that might be necessary or helpful to the process.
Good, we'd appreciate that. Supervisor Conover.
Yeah, just follow on Supervisor Bramer's comments. I'm very happy to hear for the capital plan that the countryside priorities, the cost, the elements. And I hope that as you do those things well, the staging, the phasing, because the building is occupied, so the implementation may be, make sure our implementation thinking is sensitive to an operating condition.
Well, thank you very much. Any other questions from the committee? Mr. Moore?
Chris, my recollection last year, Countryside was 31, 32, somewhere around there.
Yeah, our census is actually up right now, and a good thing is that Amy has really some really good ideas about getting the census up, and she's also had several private pays which are better reimbursement.
That's
for
great.
those, beds. So.
Terrific, that's nice to hear. All right, no questions? I guess we're all set. Thank you very much.
Thank you. Have a nice day.
You too.
That's good.
Yeah, that's encouraging. Are you done signing? Wait. Okay. Yeah, we'll keep them glued here.
Thank you. Done.
Thank you.
So bright out, lovely weather.
Yeah, she doesn't seem to.
A second ago, you couldn't even see out the window. It was complete whiteout. It's really breezy out there.
It is kind
That's crazy.
Their financials, right?
of out there. I haven't walked the dog in a while.
Oh, my gosh. Yeah,
Long
not
way.
today. Just got half hour.
We're all set, ladies, whenever you're ready.
All right, good morning.
Good morning.
I have two resolution requests. The first is to amend the existing contract with Zermed Inc. to, number one, reflect a 5% rate increase for claims management to $103.95 per month. That includes 500 electronic claims with additional clinic claims to be billed at 25 cents per claim. And then there's an additional annual fee of $125 that will be assessed. The second piece is to reflect a rate increase for eligibility verification to $52.50 a month. This includes 250 inquiries and then 25 cents per additional inquiries. The third is to update the language of the Health Services electronic billing system from Encore to Crescendo. The fourth is to update Zermed's address to 888 Market Street, Suite 400 in Louisville, Kentucky. Fifth is to utilize a different GL code, which is written, which is our CHA data processing and internet fees line. And sixth is to authorize automatic annual contract renewal as long as there's no more than a 5% rate increase, or unless there's the request to terminate upon 30 days written notice by either party. This is in attachment number 6. Zermed is an integral part of our point-of-care initiative, which is utilized to verify insurances before billing, and hopefully it expedites our billing process without denials. It's compatible with our electronic medical record Crescendo, and it reflects a 5% rate increase in addition to an annual raise.
All right, someone like to bring that to the floor, please. Supervisor McGowan, seconded by Supervisor McDevitt. Questions? Supervisor Driscoll. Did you have a question?
No, I
I
haven't. I
thought,
was
saw
just
your
waiting
hand
until
go.
you know.
Anyone else, anyone with any questions? There was a lot in that, though. All right, all those in favor? Aye.
Aye.
Opposed? Carried. Thank you.
Okay, the second one, I think I've broken every English rule I ever learned in grammar school, but is to approve the purchase of 5 Genesis Personal Touch Tablet A kits with scales, SpO2, which are pulse oximeters, and a blood pressure cuff for an adjusted price of $12.65 per monitor. The list price is actually $14.65 a piece. However, the sale price is $12.65, which subtracts a trade-in value of $200 per monitor that we're using to trade in of our old equipment. This is to be utilized with our Certified Home Health Agency's telemonitoring program for a total of $6,325, and to approve monthly recurring fees, which is $3 per monitor. That's for the Honeywell interface to Delta to a Crescendo, and a $30 list, which is actually list price for $40 a month, but we're getting a 25% discount to $30 per monitor for the built-in 4G cellular Honeywell Residio Life Care Solutions. And we're also requesting that that be automatically renewed, as long as there's not a 5% increase or upon 30 days written notice of termination by either party. This equipment is needed. This is attachment 12. It was a late breaker item that we added on Friday. Equipment is needed for our telemonitoring for our home health patients. The purchase is over $6,000, so it requires a resolution. The equipment is compatible with our new electronic medical record. The above price reflects the trade-in discount for existing equipment and 25% discount on reoccurring costs. Funding is in our budget and will initially be utilized to cover the expenses. However, we're planning to ultimately utilize our New York State Delivery Systems Reform Incentive Program for district funding. And the future budget amendment will be requested in the future. However, we have to wait for the 2018 books to close.
All right, someone like to bring that to the floor. Supervisor McGowan, a second to that. Supervisor Leggett, are you going to second that motion?
I will.
Okay, thank you. Any discussion? Supervisor Leggett.
Thank you, Ms. Chairwoman. The software that goes on this, is that the new software that you've been using for the home health?
This is technically not software. These are our telemonitors that we use with our electronic medical record system, and we're looking to replace the outdated monitors with the newer it's a tablet type monitor. So it's an actual kind of upgrade in equipment. And then the reoccurring costs are kind of the compatibility piece as far as the interface to make it compatible with our system, so there's maybe a little bit of a change in software.
Is that the electronic medical record application?
The electronic medical record is actually what we utilize to document our data on each patient. The telemonitoring gives us the blood pressure, the pulse, different other data that will be integrated into that electronic medical record.
Streamline?
Streamlined, I don't know. Tammy, you go for it.
So what it'll do is it allows for real-time interfacing of patient vitals. So let's just say a patient, and the nurses will schedule out when the patient's vitals are going to be taken. Whether we're finding our patients rather have them taken at 10 o'clock in the morning versus 8. It used to be back in the day 6:30. Now they're like, oh, no, I don't want it to alert till 10 o'clock now. So it'll get them to take their vitals, and then there's an automatic interface. So what that means is those vitals come into the live stream, and the nurse can look through the live stream monitor, and it'll alert red or green. So green, they're within parameters. Red, a phone call or whatever has to be made to make sure that they didn't weigh themselves with their pad or whatever they tend to do sometimes. So, and they can just retake their vitals. But what also happens is those are interfaced actually into the electronic health record. So there's an interface, so it goes to their medical record. So If you look at a patient's medical record over time, you can see those daily monitor readings. So if you're watching a patient because they have congestive heart failure, you can see their SpO2 readings, you can see their blood pressure readings, you can see their rate readings over time. And that's very valuable to a physician if they're looking at, do we need to increase visits, or whatever the case may be on a clinical level. But it's just having that data automatically interface from one to the other.
Thank you. Ms. Bramer, I thought I saw your hand up.
I think I got most of this. Is there something in our packet with this?
Yes, attachment 12.
12.
I forgot to write it on my verbiage, but it's attachment 12. It's the last
Oh, I see. Okay.
several pages.
Just one more. Can you please explain what the future budget amendment will be related to?
We've gotten these district funds over the past couple of years, and what we're doing with the treasurer's office is take that money that we get in, which is for this whole billing system, medical record system, and everything we're utilizing, putting it in deferred revenue. As we expense everything towards it, I then do a journal entry with them, and they're going to move the revenue over. So it's going to be fully cut. In this case, yes, because I talked to Rob, because it was all last year, so we put it all in last year's budget, but now we're utilizing. We've utilized $57,000 I did in August for journal entry. Now I'm going to do one for year end, probably be another $40,000, and then it definitely will pay for the monitoring.
Yes. It's just a
Your money
two-step
doesn't roll back
process because
over.
they can't use it right now.
All right, any other questions? All right, all those in favor?
Aye.
Aye. Opposed? Carried. Thank you.
We had a pending item for quality care for seniors. I did put an attachment 10 in there, which was kind of our plan for collaboration. That item was moved to the Support Services Committee, and there was a discussion on Friday with regard to that, so...
Right, I think that took care of it.
Okay, I just didn't want to not put it on the agenda.
No, that's fine.
So up to information for discussion and review. First, we got the report of expenditures and revenues and overtime and per diem use for 2018.
And that's attachment number 1. This is as of February 12th, the finals. I can tell you since then we have, for 2018, we have closed December for our home care, and we've added about another $250,000 onto the revenue, so that's good. Still to mention for 2018, we're not going to see final numbers. I know I sound like a broken record, but probably not until like April. The reason is we're still expecting, my estimate again is about $600,000 from WIC program that we record the revenues for the food vouchers that they give out. And I'm estimating about $700,000 from the preschool program, so about $1.3 million more we might see in revenues. Plus what we were just discussing about district money. Those funds are in the deferred revenue. As soon as I can show what expenses we apply toward that, they'll be moving those revenues over too. So we'll see more in 2018. Regarding 2019, so this, like I said, is as of February 12th financials, but it's as of the February 3rd payroll, comparing last year at this time to this year. And you'll see that overall we're 7.93% of the salary budget right now, and last year at this time we were 9.65%. So we're under budget, which is good right now. Attachment number 2, which is our comparing last year to this year at the exact date. Yeah, pretty much everything. Again, I just explained the salaries were a little bit over, or a little bit under. I mean, the equipment, not much difference there. We got some tents for bioterrorism this year, so that's a little bit in this year's budget that you're seeing. The big thing was in our contractual expenses. When I saw the big difference there, which is $236,000 between, and I know it's probably timing of invoices, and it is. The main reason was our rent expense that we paid to the county. $116,000 of that was reflected at this time last year. We just haven't gotten the bills yet this year. So again, it's due to timing. And same with our preschool and other expenses that we're just waiting for the last minute for those expenses to get in. And that's where we begin, the financials.
Question? Supervisor Conover.
The big, correct me if I'm wrong, the big difference year over year was where this year I think we were expecting to do a little bit more on the revenue side as opposed to 18, and I assume we're going to be keeping a very watchful eye on that going forward, so we have.
Yeah, and the other thing too is, like I said, when we budget for the year, we have like 10 different departments technically in our agency, the bottom line totals, whatever our effect to the county and to the taxpayers, I want to make sure that even though we don't have, as I said before, the revenues that we've seen in the past, you don't see the expenses in the past either. They usually correlate. So as long as that bottom line, again, is still reflective of what we budgeted or less, then we're doing okay. Well, then we have to look at why that is. And right now, my guesstimate with what we're going to get with the WIC program and our preschool and some few expenses, I think we're going to be right where we need to be for the, comparing to the last budget.
Question?
Yeah, I'm just curious to know what happened to the Thurman Rabies Clinic. Was it lack of interest?
What about the Thurman Rabies?
Is
there not on there?
It's not on there.
We can easily add one if you feel that there is interest, but I think usually what we try to do is kind of look at the numbers. And Thurman usually goes into Warrensburg, and actually we do go back and look at who participates in what clinics, and we do get a lot of Thurman people in the Warrensburg.
Yeah, that makes sense. I'm just curious.
But if you would like us to hold a specific one, we certainly can. Just have your animal control officer reach out to us. Or you could call.
Maybe I could call you and find out what the numbers were.
Okay. All right, thank you. No problem. All right, Val is going to go over our status of referrals.
Okay, the status of referrals would be attachment 3, and it shows that for January, we're minus 27% with 96 referrals, but if you look up to January of 17, there was 97. January of 18, we had a little bit more, 112, but this rate coincides with what's going on at the hospital right now. We're starting to get a lot more referrals from physician's office as opposed to the hospital. I know the hospital census has been down, so when the census at the hospital goes up, our referrals go up. But when they are sending a lot more patients to rehab and stuff like that, so we are now contacting the rehab centers to let them know that we do have a referral hanging out there, because sometimes we'll get the referral from the hospital, but when the patient's really ready for discharge, they decide, wait a minute, rehab might be more appropriate than sending them home. So now we're contacting the rehab agency to say we have a pending referral on one of the patients that has gone to rehab, so that they will, with hopes that they will then send that patient's referral back to us versus another agency.
All right, thank you.
Numbers are the same.
All right, also included in your packets are the emergency response and preparedness activity sheet, which is attachment 4. The rabies report is also attachment number 5. I did include the rabies schedule. If you look at the blue one, that is the most up-to-date, because we added the Hadley Luzerne Clinic Friday after I'd already printed. As far as informational items, we have 2 meeting authorization forms that were submitted. Basically, these are webinar trainings through SUNY Albany School of Public Health for Jody Brines, our supervising public health nurse, to take. One is a PRI, which is a patient review instrument, and the other is a screening course. They're both $275 each, and they are webinars, so she'll be doing that right at our office. So we submitted forms requesting permission for that. And that's attachment 7 with a backup and attachment 8 with a backup. Passing update, we want to congratulate Jody Brines, our supervising public health nurse, on her selection as February's Warren County Employee of the Month. We're very proud of her, and we thank you for the opportunity to submit employees for consideration for the Employee of the Month. It was extra special since it was the first, so thank you for that. And for nursing positions, we are continually recruiting, but this past month, February, we've hired 2 nurses full-time, and they're in process of completing orientation. So we're also in the process of entertaining another application, so we're hoping we will be fully staffed soon. I did put in some intent to fill forms in February. The first is for a registered professional nurse. This is position number 39. This is a position for nurses that have an associate degree level. Our other 2 open positions are for nurses with 4-year, so this provides us a little flexibility to be able to hire whatever the nurse's background is if we find the perfect candidate. We also put in for the public health liaison, which is a part-time position. It's 24 hours per week average. It's totally grant funded. That's attachment 11B. We had that open. We did the recruitment for it. We found the person, and our intent to fill form had expired by a month, so we just need to re-up that. And then finally, we're looking at the Assistant Director of Public Health position, which is attachment 11C. Through our succession planning, we said that we were going to hold that vacant for a year to try to provide an internal candidate some supervisory experience for the potential to move up. So we're kind of in that process now. We're looking to post in March and hire in April.
Okay, we do need a motion on the intent to fill for these 3 positions, so if someone would like to make that motion. Supervisor McGowan, seconded by Mr. Driscoll. All those in favor?
Aye.
Opposed? Carried. Thank you.
Finally, we have a guest speaker with us today. I'll let Dan do the formal introduction, but we have an informational presentation from Adirondack Health Institute on P1, just to provide information. There is also an attachment 9 referring to after the board meeting March 15th, there'll be a lunch and learn, and Dan has put together a panel presentation for you to ask questions if you have any, and we tried to kind of grab a lot of people that would have experience that could maybe answer your questions. So with that, I'll turn it over to Dan and Travis.
Can I just ask, how is the presentation set up? Is there a clicker for him to be able to use?
Turn it on.
Okay. Perfect. So thank you all for giving us a little bit of time here today to come up. I'm going to be very brief, so Travis can get right into it, but I'm sure you're all aware of T21 or Tobacco 21 throughout the state and a lot of these initiatives. We felt, as a health department, it was important to provide some education on T21 and what's happening in other parts, as well as what maybe may happen around here. So Travis has worked with a lot of our neighboring counties with ethics, with some of the other counties south of here as well. He has a lot of information just to share with you what's happening. He's got some packets for you, and then answer any questions that come from it. But again, Travis with AHI.
Morning. Thank you for having me, folks. I won't take too awful much of your time today, but I do have some folders. I have 12 copies. I wasn't sure how many people we have, so I don't know how we want to have them. It's going to have a packet information about the Population Health Improvement Program, which I'm a part of through the Adirondack Health Institute. We're a Department of Health funded grant to provide population health in the North Country. We're one of 11 FIPs, if you will. Population Health Improvement Programs are called FIP. And we serve Clinton, Essex, Hamilton, Warren, and Washington counties. So one of the things I want to talk about today was the benefits of raising the sale age for tobacco products. I'm part of a Tobacco 21 committee that's been put forth through Warren County Public Health, or Warren County Health Services, I should say, and was asked today to talk a little bit about the benefits around raising the sale age, so we'll do that. We had about March of 2017, there was over 35 organizations throughout the North Country that came together to talk about health disparities in the North Country. In the North Country region, tobacco use is one of the highest rates in the state. We are the highest rate now. We were the second highest region at the time when this committee got together. So there was a task force created with over 35 organizations to start to address strategies to reduce tobacco use throughout the North Country, and one of those strategies was to raise the sale age component. So we have 500,000 people annually in the United States die related to tobacco use. In New York State, that's roughly 28,000 people. 1964, 42% of adult Americans used tobacco. We fast forward to today, that's 15%, so there's been a lot of progress made in the United States over these last 50 years, if you will, or 52 years, but we still have an issue, especially in rural areas, such as the North Country. I mentioned before, roughly 500,000 people die annually. That's more than all of the total of Americans who had died in World War II. So, and we're talking about annual first for tobacco use-related deaths. And that's not to count the secondhand smoke-related deaths, opioids, and the other types of deaths up on the screen. When we get to the North Country, I have this particular graph broken out by county. You'll see Warren County is at 23.2% for adults 18 years and older using tobacco. New York State average is 14.2%, which is roughly 1% lower than the United States average. But Warren County is significantly higher than the state average, as you can see. And then when you look at income, because a lot of times in rural areas, as a lot of us know, poverty or livelihood is a lot more difficult for people to earn real strong wages. We'll start to see that those rates go up significantly throughout the region as well versus the state average. Only region that's under state average is Hamilton County. Not as many people in that county, and there's a lot of people that vacation in and out of that county as well, so that would factor into some of that. So that may not be totally accurate, but those are the numbers that we got from the Department of Health. And then you break it down into ages 18 to 24, and then males 18 to 24. You'll see there's a big discrepancy from the North Country as well to New York State average. So there's generally a concern. So I talked about adults 18 years and older using tobacco, and there's been progress across the nation. New York State, the rates have gone down. We have an issue in the North Country, as I just presented. But there's a whole other epidemic that's occurring, and that's around electronic cigarettes. Electronic nicotine products, and vaping is part of that component. And Surgeon General put a report out in 2016 saying that electronic cigarettes are the most commonly used tobacco product for youth in the United States. Now, how does that relate to New York State? Well, in 2014 to 2016, the vaping use or electronic cigarette use doubled. Today, it's 27% of high school students in New York State use electronic cigarettes or vaping, if you will, also known as juuling, also known as hookah, also known as some various other forms, but most commonly known as juul or vaping. The other thing that we have factoring in is the governor did a cancer initiative that she kicked off in 2017, I believe it was October of 2017, and they looked at the 4 highest regions in the state, and Warren County is the highest in the state for all types of cancer. So there's a study that's been going on through the Department of Health to try and identify what those concerns are that are contributing to that. And specific to Warren County, that study isn't finalized, but the report that's referenced on this slide states that for all those folks that were diagnosed with lung cancer that were reported through the registry through New York State Department of Health, almost everyone, when they were looking at the data, had been smokers or are smokers. So there's some relevance along those lines that we're really looking at as Warren County goes through this process, through this initiative. These are health indicators through the Department of Health, and this is per 100,000 population, and this is talking about different types of cancers, incidence rates, death rate. You'll notice it's quite significant when you start to see Warren County compared to the state average. Now, one of the benefits of 21 being the critical age, well, 95% of current adults started before they were 21. It's also an age of addiction that you have a propensity to become more addicted because you're more able and apt to do risky type of behaviors. So that's going to factor into those poor choices, if you will, or that choice of trying something that could become an addiction. Then the Surgeon General also had noted in the report from 2015, I believe, that stated that youth and risk is usually much higher when you're younger. And that was backed up as well through other studies that say that your brain is not fully developed until you're the age of 25. So there's a lot around that right now, around youth and making choices that may not be fully thought through because you're not developed cognitively to your full capacity. So other things that might add on if you were going to use tobacco that you would be more propensity to try is you'd have more propensity to try alcohol, marijuana, cocaine. High school dropout rates would tend to be potentially higher, and then higher rates of unplanned pregnancy. So then you look at, well, geez, you have to be 21 to do some other things in life as well. I mean, some of these things that are listed up here are not necessarily things that are passed by law. It's choices, you know, such as casinos, if you will, having an age for gambling, or insurance. You want to have someone to be 25 years of age in order to, you know, rent a vehicle, if you will. So you start to look at those sorts of things, and, you know, a lot of it's around the fact that risk tends to be much higher when they're younger. So, 18-year-olds, 19-year-olds, 20-year-olds, they're purchasing 2% of tobacco sales, but yet they're supplying 90% of that addiction to youth that are 15-year-old, 17-year-old, 14 years old. I mean, the average age of introduction in New York State for trying tobacco for youth is 13 currently. So you're looking at that piece. So one of the ideas behind the strategy of raising the sale age is pulling that 18-year-old category out of the schools. 80% of high school graduates are 18 years old, roughly. So you know, you've got a dynamic that if they were removed, they're not necessarily going to be, a 21-year-old's not going to necessarily be hanging out with a 15-year-old in most cases. The National Academies of Science, which was known as the Institute of Medicine, put out a study as well in the last couple of years saying that, you know, raising the sale age would save lives, it would save money, particularly around healthcare savings. Over time, if you were to introduce a law to go to 21 for tobacco usage, you would have some impacts. A decline in smoking for 15 to 17-year-olds would decrease by 25% roughly. The median impacts, you have a 12% drop in premature deaths. SIDS, Sudden Infant Death Syndrome, there was a study done that's saying that an infant of a mother who smokes is 5 times more likely to die from SIDS. So that's a staggering study that's been put out. Specific to Warren County, through census data, there's roughly 3,200 people between the ages of 0 and 17. There's like roughly, this is 2015 data, roughly 12,640 youth between 0 to 17. So you'd be looking at potentially positive impact toward, you know, not having those youth exposed to that tobacco or potentially trying the tobacco. 2012 to 2014, there was 486 Warren County residents who died prematurely due to tobacco-related illness. And the New York State Comptroller's Division of Budget Office says Warren County share of Medicaid is $12.6 million. So that local cost would potentially go down because you want to be caring for those medical concerns at such a high rate around the tobacco usage. It's a popular concept. Roughly 70%, 69.9% of adults who smoke currently are in favor of raising the sale age because they wish they'd never started, because 95% of them started before they were 21 years of age. That's been statistically proven time and time again. Right now, there's 16 counties in New York State that have gone T21, and that's not including all 5 boroughs of New York City. The most recent county is Putnam County. Essex County went effective January 1st of this year, so they had passed early September. They had passed legislation to go into effect, and what they did during the last quarter of the year was did a lot of education to local communities, to local businesses, etc., around the change, and it's in effect, and there hasn't been any big blowback or pushback at this point that I've been hearing. We were part of that task force for that implementation when they went to the supervisory group there as well. Is there any questions? I kind of went through this. I know you've been in here for a while. Yes?
Yeah, I'd like to say I'm an enthusiastic supporter of what you're proposing. I'd like to intelligently be convinced by science that your conclusions are indeed valid. Okay, and let me tell you where I have an issue. Okay,
yes.
I don't think anyone would disagree with the fact that we take children and we educate them through parents, through school systems, from the time they're infants to the time they're 18 years old. I mean, how much education does any human being need to be convinced that this is a major health issue in their lives, you know? But we give people responsibility to vote, we give them responsibility to serve in our military, and so I'm having some difficulty. I'd like to be convinced, I really would, but I'm having some difficulty because of just all of the education, all of the training we give young children, and now government at age 19 when it comes to smoking is somehow the answer. So I'm grappling with it. I want to come to your luncheon, but at this point I'm not convinced, and I got to just tell you that. No,
I appreciate that feedback. You know, there's a lot of discussion around this topic, clearly. You know, the whole thing around military, if the person has the right to vote, right to go to war, fight for your country. I can tell you that all the branches of the military have come forward and put forward their policies to change to curb smoking because of troop readiness, the impact away from work on the military field, the $1.6 billion spent annually through the armed forces to treat tobacco-related illness in the military. And that stuff's documented through military itself. So that's one thing. The other thing that comes to the mind as I just responding, you know, because it's a good discussion, is the fact that social determinants of health, you know, a person's economic status, their educational status, their you know, accessibility to health services, the whole educational component around that. In rural areas, that tends to be more of a concern, and it impacts people from making those healthy decisions or accessing those services to cease if they were to make that decision and become addicted. So we face that in the country. I mentioned early on that, you know, we have the highest rates in all of New York State in the 6 counties that I had mentioned. It went up from being the second highest 2 years ago. So we aren't getting better even though the state is going down. And that's not talking about the whole vaping component, which is clearly an issue in the North Country. I mean, Dan could attest just through his visits to school districts about the vaping issues, the issues around all that. So those are real discussions that I think would be benefited through Lunch and Learn, through providing more source direct information to you so that you might have a better sense of where some of this is coming from.
when you add the vaping, I totally agree with you. It's a whole new dynamic in terms of seducing people to start smoking. Okay, so just one thing comes to mind very briefly, and just a quick little story. I can remember, about a year ago, I can remember, I'm waiting for a red light at the intersection of South Street and Elm Street, and there are these two little boys, brothers, going across the street. They both had Joe Camel jackets on, okay, those satin shiny jackets, and I looked at them and I said to myself, this is not fair, okay? This is big tobacco seducing children to smoke Camel cigarettes, and kind of like there ought to be a law, you know? So it was, it just didn't seem to be fair, okay? So,
yes. And that you said it right on, big tobacco, marketing strategies, disparate populations, you know, it's really a focal point, and there's more and more literature and studies coming out that point to big tobacco targeting, you know, the less fortunate, if you will, in many ways. And I think what happens with the whole vaping component, they're not highly regulated in that industry at this point, so they're able to do those tactics tenfold because there's nothing pulling in from a regulatory component to bring that back. Juul has got it's almost 78% of the market share of the electronic cigarette industry currently. They just came into business 2 years ago. They market and they use social media for a lot of and this has been statistically proven in studies again, for a lot of their marketing strategy. And by doing that, you'll see youth or young adults in their Instagram ads, in their, you know, Twitter account, all that type of stuff that it's saying, hey, this is cool, you know, and it's going on back in the day when it was cool to smoke cigarettes and it was more acceptable. So, and the other thing that a lot of youth and parents, for that matter, don't realize is there's nicotine in that vapor. there's nicotine and a lot of other chemicals that are very addicting. Juul has 5% nicotine, equivalent of a pack of cigarettes, in one of those little pods. A kid 14 years old is not going to know that unless they're educated about that. And even then, there's going to be some support and education that's going to occur.
Another component also, and it's just the amount of literature. You walk into the average Stewart's, and you just look around, there's got to be half a dozen advertisements that you just quickly, your eye comes into communication with, talking about the low cost of cigarettes, you know. I just kind of like, how someone can afford to buy a $10 pack of cigarettes, it kind of, I don't know.
He's answering questions so bad.
Yes, thank
Direct it
you.
toward him, yeah.
Thank you. Just a couple of points. One of the naysayers up in Essex County said that folks were going to be traveling down to northern Warren County to buy their smokes, and that their economy was going to take a hit. My sister works for CVS Corporation in Rhode Island, and they made a business decision a couple of years ago not to sell any cigarettes in any of their stores. Initially, you would expect that some people were upset, disappointed that they had to go elsewhere. Within literally months, just a few months, all that got resolved. Their revenues were consistent with where they were before they made that corporate decision. And it is hypocritical for a business that's supposed to be in the business of helping to improve the quality of people's lives, selling cigarettes. So.
And I just, there was a very good study done with one of the suburbs of Boston that went to a tobacco 21 form. And they were concerned that their businesses were going to go to the other suburbs. That didn't happen at all. And that's not talking county, that's talking a few miles. The truth is, people don't travel that far for what they want. They want it, even when the ages are different. And that was an actual study done. It's actually a scientific valid study of what happened when they went to this T21. Nothing happened. Nothing changed in their business. One of the reasons is that population is such a small amount of the population that is using tobacco anyways, when you look at the grand scheme of things. Secondarily, they're not usually the groups that are traveling to buy things like milk, eggs, bread, that kind of stuff, which is often associated with your convenience. So that didn't happen. It has not borne out anywhere where this has happened that people travel elsewhere. So you're not losing business or tax revenue because of this. It's not in any of the places where this has occurred.
That was Needham, Massachusetts. That's roughly 15 years ago, 14 years ago now. They were the first in the country to go to T21. And as Dan said, no one went out of business.
And the other thing I think that we'll see is a reduction in tobacco use within that specific community, like measuring what was going on within the school settings. And that is something that they saw. So the underage tobacco access was no longer there. And that's one of the things we look at with T21 is that access for underage. When you have an 18-year-old who's interacting with a 15 or 16-year-old, especially within our school districts, it's not unheard of to have 14 or 15-year-olds have to play on sports teams or after-school activities with these older populations. So you're seeing that. When you move that age to 21, that access point is broken as well. Because, again, those demographics don't generally mix frequently. And so you cut off access to supply at a younger age, which, again, is where we see a lot of that addiction happening. So that's one of the other benefits that you see is just showing what's happening around the country and other locations.
Audie, you had a question, and I think we'll wrap it up, and any other questions come to the lunch. And
That's a good point. Now, I want to say thank you, and just to Supervisor McDevitt, I think the data is there. That's the big piece for me, why I would like to see this, because, I have young kids, and I want to remove that ability for them to access these products, especially the e-cigarettes, because, most of the kids now, my daughter's 11, she says, nobody smokes cigarettes, that's gross. But these other things, they're like little electronic, they're gadgeties, and they're marketing to the kids, and they want to get them, and even if I educate my kids as much as I want, they're kids and they still have not developed brains. They act stupid, and that is, to me, those are data points that you can use to support something like this, to raise that age to 21 and get it out of the hands of our younger kids. If they want to do it when they're older, fine. And the military doesn't want them to be doing it.
That 27%, that skyrocketed, a lot of it is, I mentioned the risk factor, but flavors. I'll just leave it at that and we can get those, but flavors are appealing to youth, and that's what's being marketed, are the different flavors. And that's not what's being regulated at this point, so that's a big concern. And it's going to lead to future generations of hardcore, traditional cigarettes, amongst other things. And that's the epidemic that we're facing currently. So it's something to know. I really appreciate all your time. And yes, please come to the luncheon.
Well, we appreciate you coming to do this presentation. I think it was very valuable for all of us, and yes, let's make a point of trying to make it to the luncheon. Janelle, did you have anything else?
All set,
With
thank
that,
you.
I will entertain a motion to adjourn. Supervisor Sokol, seconded by Supervisor McGowan. All those in favor?
Aye.
Aye. Sure nobody's opposed.
Oh, wait, just to confirm that one. All right, there you go.